So I'm really excited to do this interview today with Kim Ross because she is a stroke specialist, and I happen to have a friend, Julie, who had a stroke 6 years ago, totally unexpected, one day, and I don't know whether she'd like to share that or not, but let me go ahead and introduce you to my friend Julie and her service dog Ollie first. So you have a service dog?
Yes, this is Ollie. He's my service dog. He helps me out at home with tasks. He picks things up. He carries things. He goes to work with me. Ollie. Lucia, there you are, pretty boy. So he goes to work with me, helps me out if I drop things. I'm one-handed, so basically my left hand. He's also trained to help me with the laundry. He'll climb in the dryer and pull clothes out, take clothes out of my basket, hand them to me. He pulls out pots, and if I pull the drawer out, he'll take out the pots and pans for me and hand them to me.
Oh, wow.
Just anything, because I can't bend very well.
So you're paralyzed on your left side.
I had a stroke on the right side of my brain and on the left side.
Okay.
Yep.
Yeah.
Yep. He's my helper now.
Okay.
He's
And this,
very cute. Look at him.
he is very cute.
Look at him. Yeah.
And so this is Kim. And how long have you known Julie, Kim?
Gosh, going on over 4 years?
Yeah.
Yeah,
Yeah,
over 4
definitely.
years.
Okay.
And she keeps me doing the things that I'm doing every day. I have such an appreciation for stroke survivors. It's not easy. I think stroke is a lot like trauma, where 1 minute you're fine and the next minute you're not. And unfortunately, stroke is the #1 cause of disability in the United States. It's the 5th leading cause of death. Every 40 seconds somebody has a stroke, and every 4 minutes somebody dies of a stroke. So I'm super passionate. May is Stroke Awareness Month. I've been doing stroke, the disease process, for about 10 years. And like I said, I think it's people like Julie that inspire me, that they, bring hope to people that continue to try to fight off this disease, because it is horrific in so many ways. I want to just give this opportunity to educate on the signs and symptoms of stroke.
Okay.
This is BFAST, and this is what we use, the acronym that we use to identify whether or not somebody might be having a stroke. You only have to have one symptom. It's balance. B is balance, and it's a sudden loss of balance. E is eyes, so it's double vision, missing vision, or blurred vision. F is face, so it could be a facial droop on one side of the mouth or the other. A is arms, and arm weakness on one side or the other. It also could be legs. And then S is speech, slurred speech, garbled speech, repetitive speech, or no speech, or speech that doesn't make any sense. And then T is time, and time is brain. So we want you to call 911 immediately, because there is treatment for the clotting stroke in the event that you're able to get to the hospital in time. So it's important that you call 911, because they will take you to the nearest stroke center. And then there's one more symptom that we don't talk about often, but it's a sudden, severe, worst headache of my life. That could also be a signal. That could also signal that you could be having the other kind of stroke. Technically, there's 2 kinds of strokes. There's a hemorrhagic stroke, which is the bleeding stroke or the rupture of a vessel. And there's the ischemic stroke, which in Julie's case is the clotting stroke. The clotting stroke happens about 87% of the time, and the bleeding stroke is 13% of the time. So the clotting stroke happens significantly more often. I think, as a whole, I think there's a lot of risk factors that cause stroke, such as high blood pressure is the #1 cause of stroke, diabetes, cholesterol, smoking. But the hardest thing is if people don't recognize that they're having a stroke, they may miss out on that opportunity for treatment. So in May, we're at a health fair right now, and we try to really emphasize the signs and symptoms of stroke, because we want the community. I mean, I had my little 9-year-old going to her 4th grade class and educating the entire class on the signs and symptoms of stroke.
Nice.
I have my 6-year-old today actually now has BFAST memorized, and I can't stress it enough how important it is. So we appreciate opportunities to get the information out. Here we are at a health fair, like I said, and it's people that are interested in taking care of themselves better, because I think the other unfortunate part about stroke is, sometimes you don't have necessarily risk factors, but if you have a stroke in your family and you have a family history of stroke, that does have a genetic predisposition to it.
Okay.
So keep fighting stroke because, again, it makes a difference. And unfortunately, it doesn't always turn out great. I feel for Julie's left side here, but the fact that positive people are in my life and keep me going, it helps me to remember that, we have an opportunity to help everybody that suffers from it as long as they get there in time. So I'm excited that we met through a stroke support group, and I'm getting ready to start a stroke peer visitation group that I'm working on in my master's, and I'm really excited about Julie and one of my other friends to be helping me kind of start the initial process of it. But it's important. I think it's important to give people hope after stroke because it is a debilitating and a very difficult disease process.
Well, I met Julie last year, and she had come to one of my meetups down here in Colorado, and specifically because she wanted to see how other van people were building out their vans, and she wanted to sit in them and see what her capability would be in these different style vans. So that's how we actually met. So she's a very inspirational person. And
I'm telling you, yep, that's why I have her in my life.
Yeah, so it's wonderful to know you, Julie, and just wish you the best. And I know you're gonna come through this, and you're gonna inspire so many people because of this. So.
And I hope you know that you do. You give people like me hope every day to keep doing what I'm doing.
What is your background?
So I have 2 degrees. I was an athletic trainer prior to becoming a nurse, and then I went to Grand Canyon University and obtained my BSN, Bachelor of Science in Nursing. And then I worked in Phoenix, and I had a lot of experience with trauma. So trauma actually was my first passion, but as you can imagine, there's a lot of head trauma that comes with multi-system trauma. And so I understood the brain, and the brain actually came kind of easy to me. And so when I came out here to Parker, Colorado, I looked for a job as an ICU nurse because that's my background, is I'm an ICU nurse, an intensive care unit nurse. And I started stroke. I didn't actually know the disease process all that well 10 years ago when I took this job. So my position is called the Neuroscience and Stroke Clinical Coordinator. So again, I am a nurse. I'm currently in my master's at Grand Canyon University, and I'm getting a master in leadership, in nursing leadership, because I essentially run the stroke program. And so leadership will help me to be able to do that a little bit better and more efficient.
I know that you mentioned some symptoms, high blood pressure and things like that. How does stress play into this?
Yeah, absolutely. So, we tend to see more strokes in the November, December, and January time frame. And if you really think about it, we're not eating as well. So we're traveling, so there's dehydration that plays a role. Because we're not eating as well and we're eating a lot more salt, then our blood pressure tends to go up. And hypertension, which is high blood pressure, is the #1 cause of stroke. So I think it's important that we manage stress and we manage the holidays and we manage things because they can obviously cause stroke. There's other things that can cause stroke, such as sleep apnea, and like I said, drug use and alcohol and such. But primarily the big 3 are going to be your high cholesterol, your diabetes, which is not being able to control your blood sugars, as well as your blood pressure and your hypertension.
So what can people do to prevent stroke?
Yes.
Other than, taking care of your health?
For sure. I think the biggest thing is you can see your primary care doctor at least once a year. Make sure that you're getting your labs taken. Make sure you're getting your blood pressure taken. Awareness. That's how we can prevent stroke. If people are aware of what causes stroke and they can actually treat those things that cause stroke. Unfortunately, there are such things as cryptogenic or idiopathic stroke in which we don't really know why it happens. There's such thing as atrial fibrillation, which is an irregular heartbeat, and that can cause a stroke. I think just taking care of yourself and coming to health fairs like this and getting your blood drawn and checking out what your cholesterol level is, and then Julie just got her blood pressure taken. That's hugely important because a lot of people think that blood pressure is tied to, I don't eat well and I don't exercise and such. But to be fair, you can be really, really healthy and have high blood pressure if you have a genetic predisposition to high blood pressure in your family.
So what resources then? I know Julie has tapped into several resources that she's mentioned, but let me ask you, what resources are available to people.
Yeah, I'm really passionate about this, and I'm forever thankful to the hospital that I work at because they invested in a stroke support group. And I think it's so important because once you get connected in that stroke support group, it's great because friendships form and resources such as neurologists coming in and speaking, adaptive equipment organizations coming in and speaking, dietary, nutrition, and such. So I think it's important to try to find whether or not your area has a stroke support group. Sometimes starting at the hospital with a stroke center is the best place. I personally, as a result of our stroke support group, I believe that all stroke centers should have a stroke support group. I do.
I agree.
And so we hand out a flyer to we have almost 300 strokes a year that come into our hospital, and we hand out a flyer to every single stroke unfortunately victim per se, because in that initial phase, unfortunately, they have just suffered that stroke. But we hand a flyer out and we encourage them to come. I will tell you there is a very, very high incidence of post-stroke depression. And, you know, if you think about it, you know, you have to adapt to your new norm. And so I think stroke support groups really help with that because they help you feel a little bit more like, okay, this person gets it and these people get it. And sometimes we call it, you know, stroke club because it's like a social hour, and that's okay. But the important part is it's a safe place where people come together and they understand one another.
Mm-hmm. And how do you support the families?
Yeah, so it's called the Stroke Survivor and Caregiver Group. Okay. And so we absolutely, when we were meeting in person, we were able to have 2 breakout groups, one with the stroke survivors and one with the stroke caregivers. Unfortunately, as a result of COVID, you know, we have gone virtual. However, the virtual is a nice option for those who cannot drive or who cannot get to the stroke support group. So I think it is important also for caregivers to get that same support. Ollie needs the same support that Julie needs because like she said, you know, Ollie is her left side, and
right.
I think that it is extremely important to make sure that we're including those caregivers. And sometimes caregivers are friends, sometimes they're family, sometimes, you know, they're our pets.
Mm-hmm.
It's not a pet.
True. That is true.
Well, he thinks he is.
He does think he
thinks
is.
he is. Everybody treats him like, look at him. Yeah, they're talking about you.
He does think he is.
Yeah.
The really cool part, you guys, is I've been in stroke for 10 years and I have actually seen some major advancements. I think right now the big focus on the major advancements is imaging. We're able to do more with our imaging and be able to tell more about the stroke in terms of how long ago it happened. And so I think that's great. I think the adaptive equipment out today is unbelievable. Julie is huge with bringing in, you know, people that we can connect with where we can help share stuff like different kind of bikes and things that, you know, and even, gosh, I mean, the van situation, right?
Yeah, there is life after stroke.
Yeah, absolutely. And honestly, I wouldn't be able to sit here and talk about stroke with a smile on my face if I didn't know about that life after stroke, because it is a debilitating disease, unfortunately. However, there are, like we said, there's grants out there, you guys. There's, you know, there are opportunities, hands down. And I wish there were more, and we talked about that at our last group. We wish things were a little bit more accessible for people, and that we'll continue to advocate.
Mm-hmm. So the key is to be fast. Let's go over those one more time.
Yes, so balance, sudden loss of balance, eyes, double vision, blurred vision, missing vision. F is face, a facial droop. A is arms, a weakness, a tingling or numbness on one side of your body, or arms or legs, or arms and legs. S is speech, slurred speech, garbled speech, repetitive speech, or missing speech. T is time is brain, and then also sudden severe headache can also signify one of the bleeding strokes. Guys, I can't stress it enough. 911, get to a hospital. We have a medication that we can use to break up the clot, and then if it's a blood pressure stroke or the bleeding stroke, then we can get that blood pressure down to help slow down the bleeding.
So the faster the better.
Yep.
All right, be fast.
Time is brain.
Yeah, time is brain. Awesome. Thank you so much. I think this will be very helpful for so many people. At least bring so much awareness.
We thank you, because that's why we're here at the health fair. So many people do not know what the signs and symptoms of stroke are. So guys, if you hear this, if you see this, if you read this, if you learn this, please go teach someone else.
There you go. Go teach somebody else. Be fast. So let's talk about the brain a little bit. I see you have a model here.
Yeah, I love to bring this model with me when I go do education. So the brain is essentially divided into two hemispheres. So we have, right here is the right hemisphere and this is the left hemisphere. As far as the areas of the brain, this is called the frontal lobe. There's several lobes, but this is the frontal lobe, this is the temporal lobe, this is the parietal lobe. I like to put my hand around it. And then this is the occipital lobe back here. So this is the back of the brain. Okay, and this is the cerebellum. This is the area that's responsible for balance. And that's why we added the B and the E to be fast. So when we talk about the brain, I don't want to go into too much detail because, like I said, I could talk forever about the brain, but essentially this is the motor strip. And sitting right behind the motor strip, the red is the motor strip, and sitting right behind it is the sensory strip. That's the blue. So when you have a stroke, suppose you were to have a stroke over here, whether it was the clotting stroke or the bleeding stroke, and it was a left-sided stroke, then it would display symptoms on your right side. And it's because the pathways cross in the brain, lower in the brain. So this is the brain stem here, down here. This is kind of the important part. This is the part that controls heart rate and blood pressure and temperature and those kind of things. The real important things. These are all your cranial nerves, which help you with things like smiling and closing your eyes and opening your eyes and, sensation and such, and shrugging your shoulders, sticking out your tongue, eating, those kind of things. So when we talk about language, the Broca's and Wernicke's are the two language centers, and they're located for most people on the left side of the brain. There is a very small population, and when I say very small, it is a very small population that actually has speech and language over here on the right. So we're going to focus for learning purposes on the left side of the brain. This is where the speech and language center is. So fortunately, or unfortunately, in Julie's, language, depends on how much you like to talk, was spared because her stroke was over here on the right side of the brain. So that is why she has left-sided weakness. So a right-sided stroke will lead to left-sided weakness. Julie's was deep, and deep is in the basal ganglia. And the basal ganglia is this deep area back in here. So it's a really important area. It's deep within the brain. Oftentimes the bleeding stroke, people who don't control their blood pressure can often have basal ganglia strokes. I actually see basal ganglia strokes more common with the bleeding stroke than I do the clotting stroke. Yeah, but it's deep in the brain, again, often related to blood pressure. Did you know prior to your stroke if you had high blood pressure?
It fluctuated a lot.
It did, okay.
Yeah.
So, again, one reason why we need to, try to control our blood pressure. And so, yeah, this is essentially, now, again, speech and language is going to be deep in this structure here. That's the general premises of the brain without boring you and going into too much detail. But the brain is fascinating, and, we have this ability, and while I hate to say this, but once tissue dies, unfortunately, we all know dead doesn't come back to life, right? And so, unfortunately, some of that tissue can't come back to life, but you can compensate, and you can try to compensate with other areas of the brain to try. I can tell you right now, there's no stronger side than Julie's. Your right has overcompensated. Were you right-handed to begin with?
Yes.
Yeah. And sometimes, unfortunately, people have to switch their hemispheres in terms of their dominant right or left-handedness based on the stroke. Unfortunately, you don't get to pick having a stroke, and you certainly don't get to pick the location of the stroke.
Right.
But you guys can all tell that I like to talk. I'm from Chicago, and I talk fast, and I talk loud, and so for me, and I'm also a softball player, I love sports. So you think about how important, I am right-handed, you think about how important my right side is. You guys, I do everything with my right side. So a left-sided stroke would be absolutely horrific for me because it would affect my speech, my language, and potentially my right side as well. So, it's not a good place to have a stroke, guys, but just remember there is hope and recovery after stroke.
So what happens is like the blood vessels up to your brain, they either get clogged or they bleed?
Yes, so it's in the vessels, typically the arteries, and it can be the veins as well, but typically the arteries. And for the clotting stroke, you can either have a clot form in the vessel, that would be called a thrombotic stroke, or a clot could travel from your heart up to your brain, and that's an embolic stroke. So two different kinds of clotting strokes, one that forms in the vessels, one that travels. And then the hemorrhage is where a vessel ruptures. Most often that's a result of something called a aneurysm, which is an outpouching of the artery, and then it pops. But also it can be just a smaller vessel that happens because of blood pressure. You know, guys, I always use the analogy of the side of my house has, you know, garden hose, and the sun beats on that, and that garden hose gets turned on and off at high pressure, and over time the garden hose weakens and it either bursts or it gets this little outpouching in it. That is exactly what an aneurysm is, and when it bursts, that's what the hemorrhagic stroke is, or the bleeding stroke.
So it doesn't really matter if you have a heart problem or not. Are there any unusual things that happen due to a stroke?
Yeah, absolutely. I think after a stroke, as the recovery process is happening, we tend to enhance other areas of our brain. For example, a patient that might not be able to get the words out may be able to sing. And so they can hum and actually sing and say the words through singing. And it's because some of those tunes are able to be recollected, but they can't process the words, but they can use the tunes. So there is it's a compensatory mechanism of the brain, and it's actually amazing. It's similar to the word neuroplasticity, where we can build some of the brain and help to fulfill the deficits that we're experiencing by enhancing and growing and strengthening other parts of the brain, which is why recovery after stroke is such a big deal. Julie still goes to therapy. They used to say that the most recovery after stroke was in the first year, but that was misleading, because then stroke survivors felt like after the first year, no recovery. But truth be told, is recovery is an ongoing process, and I think the more you put in, the more you get out.
So you had said that dead is dead, but there can be some relief, right? In other areas,
you
if
strengthen
enhanced.
the other areas.
Strengthen the
because
other areas.
unfortunately, that area, I mean, unfortunately, you know, Julie has very limited motion in her left, and that's not likely to just all of a sudden remarkably come back. However, you can compensate as she's able to walk and as she's able to do, you know, some minimal movements and such.
Okay. Good. Yeah. Thank you so much.
Hey, thank you. Not always, but if you do have heart disease, that's a result of like plaque buildup and such, then chances are you're also going to have, you know, you could potentially have cerebrovascular disease, because it is affecting vessels. So very different. Heart is very different than brain, right? So this is where a heart attack would happen. This is called a cerebrovascular accident, or a stroke we use today, because we know that sometimes it's not by accident when, unfortunately, we have risk factors we don't always control.
Thanks for watching. Please share this video and spread the Be Fast message to others.